Your post-COVID ERISA interstitial lung disease claim or your pulmonary fibrosis claim. Now, I'm sure that you purchased a disability insurance policy or plan many years ago, and you weren't thinking that there might be a worldwide COVID pandemic that would cause multiple system disability and unfortunately death, and that you might actually contract COVID and suffer any of the known complications. Now, it's not uncommon for those who have long COVID to go on to develop interstitial lung disease, ILD. And it's also known as pulmonary fibrosis. In layman's terms, this refers to the scarring of your lungs, which over time impairs your ability to breathe. Now, most cases are diagnosed based on pulmonary function testing and biopsies. And what's important here is that it documents the nature of the inflammation and the scarring. It's not uncommon for post-COVID claims to patients to have shortness of breath, a chronic dry cough, and a significant fatigue that interferes with their ability to function on a daily basis. And getting your ERISA disability benefits for those symptoms can be tough. Disability carriers or plans really don't like COVID claims. They're still playing games with these claims, and they are demanding objective proof of the diagnosis of COVID and objective proof of any underlying complications. And at a minimum, they're going to want to see testing that you're positive for COVID and that you also have objective pulmonary testing to document the extent and nature of the lung scarring. They're going to often question the extent of the scarring, how that scarring impacts your ability to function, including breathing, exertion, fatigue. And your doctor, in support of your claim, should be prepared to address the diagnosis of COVID, the objective testing explaining the significance of your pulmonary issues, and what that testing means in terms of your functionality. You want to make sure that that testing correlates with any restrictions and limitations assigned by your physician. Your medical record should be telling the story of your symptoms and your functionality supported by the objective testing. If your claim for COVID complications, including interstitial lung disease, have been denied or your benefits terminated, call me today at 727-894-3188 for a complimentary consultation. I can help you get the disability benefits you deserve, regardless of where you live in the United States and regardless of who your disability carrier or plan might be. 727-894-3188.